Hello, and thank you for joining me once again. I'm Alicia, the Practice Nurse Mentor, and in this video, we are going to be having some in-depth discussion about health assessments in general practice. So whether you are just starting out in general practice and having to do health assessments, and you want to know a little bit more about what to do, how to do them, what things to include, then this is going to be a great video for you. If you're already pretty seasoned at doing health assessments, but you're wanting to try and fine-tune them a little bit or get some inspiration on how you can improve the quality of what you're already doing, then hopefully this video will be helpful for you as well. I'm very open to feedback. Please let me know in the comments section if you have found this to be useful. If you have any feedback on how I can be presenting a little bit better, by all means, I'm happy to take that on board because I'm pretty new to doing this whole YouTube internet thing. So by all means, please leave your feedback and your comments below. If you'd like to see some more content from what I do in the future, then subscribe and yeah, let's keep going. All right, so just briefly, the kinds of health assessments that we do generally tend to be holistic in nature. So we're not just looking at the physical side of things for a person, but also that psychosocial aspect as well as cognitive function for some of them too. We're looking at mental health, all kinds of different things. Sometimes they're targeted towards specific conditions, so heart health checks, for example, or diabetes risk, and other times there's specific populations that they're aimed at. So like the older person, someone living with an intellectual disability, Aboriginal or a Torres Strait Islander person, or the 45 to 49-year-old health checks. So most of the time the health assessments are time-based in their billing. So we have item numbers 701 through to 707 based on the time that we've taken to do that assessment. And the main exception to those ones, though, are the health check for Aboriginal and Torres Strait Islander people, which we sometimes just call the 715 health check, and the heart health check. So those ones are not time-based. They are just a flat rate for doing the assessment. When we're talking about time, it's inclusive of the time that the nurse spends with the patient to support that GP in gathering that information, as well as the GP's time and what they determine the complexity of that health assessment to have been. So all of that sort of gets put together in order to submit the most appropriate item number for that health check. The frequency, most of these can be done annually, but there are a couple of conditions to some of these health checks. They may only be able to be done once or within a specific time frame in terms of age. Our clinical software usually has built-in templates. So whether you're using Best Practice, Medical Director, any of those kinds of software packages, then you will have these templates already there. So you don't have to reinvent the wheel. You can, of course, customize. You can also add your own autofills and make things a little bit more individualized per person, or you can just have more things that you can be doing for someone, especially when we're looking at doing those health checks for older people. There's a few extra things that we do want to try and include for those, but I'll talk about that as we get towards the end of this video. Okay, so before we get started on the health assessment information, I thought I'd just put in a quick bit of information about rebate amounts so that you are aware. This is mainly aimed at people who are new to this. So you can see here our different time-based item numbers, whether they're simple through to prolonged based on that timing there, so a short duration or long. And then the scaled kind of remuneration that we get for doing them based on that time. There's those two non-time based ones, so your 715 health check and the heart health check ones there. You'll see there with the 715 health check, we can actually do those every 9 months. So most places do them about every 10 to 12 months. anyway, but they are claimable from every 9 months. So that's something to always keep in mind as well when you are forward planning to get them scheduled in for their next assessment. So it can be 9 months. The other little bit of information that I wanted to put in here as well is a little bit of statistics on the number of times that these item numbers have been claimed. Now, this is nationally, okay, not per any particular state. This is Australia-wide. I found some of this information startling in that I was shocked to see the level that the numbers so low compared to our population. We have an aging population here in Australia. Why are we not doing any more assessments than what we've already been doing? I know I do a lot, so we could be obviously doing more than what we're doing. So maybe this can be something that you can bring back to your practice, go through some of your data extraction software and have a look at how many that you actually do compared to how many eligible patients you have, and can we start to close the gap on that disparity? Because we can see by these numbers here, we're not doing enough. When we look at the 701 through to 707s, that's like 1 million people altogether compared to our population. I just think we absolutely can be doing more. There's a whole furor going on at the moment about care planning and the changes to the chronic condition management system where is going to be implemented from the 1st of July. But let me tell you, why not focus a little bit more on improving some of our health assessments, because this data is telling us that we should be. Incidentally, I also added in the claiming for 10997, so our nurse item numbers, and our 10987s. If you've watched my previous video on the care planning information, I did include a little conversation there about the number of times that we claim rebates for plans and for doing reviews of care plans, which was nowhere near enough. But also the nursing is comparatively low in how much we're claiming for that. I can't remember the specific number of how many care plans were claimed in a year in the last 12 months. But when I calculated what the true representation, if we were claiming those full 5 nurse support item numbers per person per year, then this number should be 3 or 4 times more than what it is. So it's about a fifth or a quarter of what it should be. And mind-blowingly, the same for 10987. I mean, we're not doing very many 715 health checks. We can see that there, 220,000 for the whole of Australia. I think we have more Aboriginal and Torres Strait Islander people than 220,000. I know that they're challenging, I know that, to get them to come in and have the health checks. But considering that we can claim 10 of these nurse item support numbers per year, we're clearly not claiming anywhere near the amount that we could be by looking at this data. And you can see that this data is from basically the last 10 months. I'm in June now that I'm doing this recording, and that data is current up until the end of May this year for the last financial year, basically. So I just thought that I would put this in there because I'm a big advocate of quality improvement, and I think this kind of data helps to drive the change and drive the improvement in your practice as a collective. You can look at it at your different doctor's level, and even just on a personal level as the nurse. Is there something more that you can be helping your practice and your patients in terms of health checks and nurse support? All right, moving right along, because don't get me, I can keep going on that for a while. Okay, so next I wanted to just go through the different types of health assessments that we can be doing and just have a bit of a chat about eligibility criteria, but also what kinds of things we could and should be including in these health checks, in order to optimize them for the patient, optimize them for the practice in terms of billing, and just making sure that we're doing quality health checks in that time frame that we have with that person. Now, just a little bit of a disclaimer before I go forward. Whilst I do reference a lot of government information, so your MBS item number descriptors and things like that, the content basically is based on my personal and professional experience and is intended as guidance to assist you in your own nursing practice, and as I said, to sort of build upon the quality of what's being offered at your practice. So it's not the be all and the end all. Absolutely. There are plenty of other nurses and practices and doctors doing lots more different things than what I'm suggesting in this video. But this is to help people get started with doing things, or maybe give you some ideas about how you can be expanding upon what you're currently doing with your health assessments at your practice. Okay, so if you're someone that likes to take notes, go grab a pen and a piece of paper, because we're about to get started and go through a fair bit of information. Okay? All right, so first of all, we are going to start off with doing the heart health check. And I'm going to grab a little water. Okay, so the item number for this is the 699. And basically this assessment, we are looking at risk factors to determine someone's level of cardiovascular disease risk. So when we're looking at these risk factors, we are trying to capture those modifiable and non-modifiable risk factors, so the things we can change and the things we can't change. Ideally, this assessment is aimed at people 45 years and above. I've put 75 years on this one because if you're getting to 75, then we can start looking at doing the time-based health assessments for a start, which will be way better value than this. But also, by the time we sort of start getting up into that higher age range, we're also going to be assuming a certain level of cardiovascular disease anyway, even if it's just purely age-related, not including any other comorbidities and chronic diseases that might already be present for that person. If someone is Aboriginal or Torres Strait Islander, then that age can be from 30 and above, and if they already do have diabetes, then that age can be from 35 and above. I have certainly done heart health checks on people in their mid-30s before because they had high levels of risk. And it was just absolutely worthwhile in doing that for them. So the claim went through, no problem. So I think it's something that you assess on a case-by-case basis as well. The only limitation in terms of time for this assessment is that it must be greater than 20 minutes in duration. So if you read the item descriptor on MBS for this, it says it just must be 20 minutes or more. And it does need to include a range of assessments to help determine those risk factors. So we're looking at what we call the SNAP assessment, so smoking, nutrition, alcohol, and physical activity. We would probably also be doing other assessments like making sure they've had their bloods done. So in order to calculate the CVD risk score, you need to have their lipid profile and a few other bits and pieces in order to do that. So the one thing I did want to kind of point out with this health assessment is to be a little bit careful of the amount of time that you are dedicating to this health assessment. So remember that it's only valued at $82.90, which is on par with about a 36 item number, which is for 20 to 40 minutes. So once we start getting past 40 minutes, The rebate amount for doing this health check makes it just not worth it. Even if you factor in adding in an ECG item number as well, it's still going to be less financially viable than doing a long assessment, than doing a long consult for someone. So we really have to focus on making sure that we are just getting straight to the point and doing what needs to be done in the assessment, and then arranging the follow-up to be done later, and that could be at a regular consult, because otherwise it just doesn't make it worthwhile. And I do hear that a lot from GPs that I've talked to in different practices when I go mentoring, that they don't do the health checks because it's not worth it because of the time frame involved. They're just kind of doing too much at once. And also, is someone eligible for a time-based health assessment instead? So if that person is age 45 to 49, do that assessment instead of doing a heart health check. If they're an older person over 75, don't be doing a heart health assessment, just be doing your regular time-based health assessment for an older person. So just be mindful of the health checks, like the eligibility and the time frame for them, because you want to make sure that you're optimizing your time for your money. So yes, we just want to be doing some data gathering here. We are just going to be looking at the information we need to get those risk factors identified. Now, the Heart Foundation has a fabulous template included in their toolkit. Our software, if you're using Best Practice or Medical Director, also has this embedded in your software as a fillable template that you can complete just in the software itself, and it saves there, or you can print it off and handwrite things in as well, whichever you want to do. So we're doing that SNAP assessment, as I said. We're going to calculate that CVD risk score. I do like to include an ECG if we have the time to do it on the day. If not, then I get them to come back and do it another day. Once we've determined what that risk level is, obviously if it's low risk, then we have very little to do here except provide some basic information. If they're coming back as a moderate risk, then there's going to be a need to follow up. So we're going to be looking at doing some other investigations, providing some education and some resources, maybe doing some referrals, and depending on what we're finding as we're doing all of these things, can we be assessing them for the need to have a chronic disease management plan, and so on. So all of those things are follow-ons at other appointments, rather than trying to fit it all into less than like 20 to 40 minutes for a 699 health check. Okay, so that's probably one of my main takeaway points for this, is to try and get it done in that 40-minute time frames or less, and that's combined the nurse time with the doctor time as well. So and do access that Heart Foundation toolkit, because they have an amazing amount of resources, or from all kinds of templates. They have resources for you as well as for the patients. They even have little scripts that admin reception team can do if you want to be doing a quality improvement activity. It'll step you through how to do recalls, all that kind of stuff. So it's a great resource, so go ahead and access that. All right, so next we are going to talk about the 45 to 49-year-old health check. We call this one the midlife health check. This one's claimable once per year as long as they are in that age range. Okay, once they reach 50, they can no longer have that health check anymore. This one is all about that early detection and intervention. So someone usually in this age range has at least one risk factor. One of those is probably going to be age, but whether it's a lifestyle factor, whether it's a family history or something like that, then they're going to be eligible to have this health assessment done. As I said, this is a time-based one. Generally spent the first part of it with the nurse, gathering the information, and then it finishes it off with the GP. Most of the time, this will go for around about that 45 minutes to an hour in total. So what kinds of things are we going to include with this one? Obviously, we're going to do our full obs, heart rate, blood pressure, height and weight, waist measurement, all of those sorts of things. I don't tend to focus too much on the BMI. I know it's still the number to be talked about, but I like to look at the waist measurement, and I have like a graph, color graph printed off at my desk, and we look at the waist measurement in terms of increased levels of risk. So whether it's male or female, as it starts to go up in risk, as it starts to go up in the centimeters of circumference, it also increases that level of risk. So for things not just like heart problems, diabetes, but also bowel cancer and things like that, increases with an increased waist circumference. So that's something that I do like to make sure that I always get a waist measurement. Obviously, we're going to be ensuring that we have all full family history there as well. And then I do my SNAP-DOs. SNAP-DOs. So my little acronym there is for smoking, and I also include vaping these days because it's just as harmful. Nutrition, alcohol intake, physical activity, and then I look at mental health, osteoporosis risk, and our sleep apnea. So let me just go through those a little bit more. So your SNAPs are basically your lifestyle factors that we are looking at here. Getting an accurate representation of where they're at with what their current lifestyle is. Smoking and vaping, yes, a lot of people think that vaping is healthier than smoking, so I do like to make sure I provide some information to them about that all the time. Nutrition here, I like to just ask them, just tell me about a day in the life of you in terms of what you eat and drink, starting from when you wake up through to when you go to bed at night, and include all your naughty snacks if you have them, include your healthy snacks, and what you have just on a normal average day. This is what I'm looking for. I want to see that they're having a variety of foods across all of the food groups, that they're having some dairy food, an appropriate level of calcium, and I do have some handouts that I like to give on that as well. Are they eating too much fatty foods, processed foods, salt intake? They're drinking too many soft drinks, all those kinds of stuff. Having enough water. But they're basically just looking across that whole nutritional span there. Alcohol intake, again, I have another little chart there at my desk which has the standard drinks on it, with a couple of different examples for like wine and spirits and beers, so that we're getting an accurate representation of what that alcohol intake is like. A lot of people say, oh, well, I have 2 glasses of wine. Well, I'll be guilty and say that I put my wine all the way to the top. So if I was to say I have 2 glasses of wine, I'm probably having 4 standard drinks, if not more. So it's really important to get that accuracy and have that data collected into your software. Physical activity. Here I also like to sort of be specific and say, what kind of things do you do to keep active outside of your normal work duties? Because a lot of people go, well, I'm really active with my job. I'm up and down the corridor all day, or I'm up and down the stairs instead of using the elevator. Great, fabulous. But what else are we doing that's getting your heart rate up? Because the things that you're doing on a normal day-to-day basis, your body's adapted to that. It's not raising your heart rate. It's not changing your metabolic rate. It's not increasing the tonicity of your muscles and the strength, for bone health and all that kind of stuff. So we want to be looking at things outside of their normal day-to-day activities at work or around the house. So are they doing specific targeted exercise during the week? That's the kinds of things that we want to be looking at. Next, so we're doing the depression and mental health check. So you can do the DAS21. Most software has this built already. You can just quickly go up into your tools and find where that template is, and they are basically just ticking through those boxes, and you're calculating the score to look at depression, anxiety, and stress levels. This is a really important one that often gets missed in these general health assessments. We know that there's a lot of mental health going around in this age group. There's a lot going on in this age group. So I think it's a really important inclusion, and if it's something to be followed up on at a different appointment, that can then be followed up with a mental health care plan, then great. But this is a good opportunity to just ask about it and do the quiz, and just to get a bit of an idea of where their head is at. I also like to do an osteoporosis risk. So one of the big issues I think that faces people with osteopenia is that it's been building for a while, probably for like a decade or more, before we start hitting that point where we're routinely checking for this kind of thing. So we have more and more younger people, and I mean in their 20s and 30s, that are starting to have early onset osteopenia and having minimal trauma fractures because of things like lifestyle. So not eating enough calcium, dairy, or drinking soft drinks, alcohol intake, not having strength-based physical activity, all that kind of stuff. So you can easily pop over to the Healthy Bones website and do the Know Your Bones quiz. Super quick, doesn't take too long to gather the information while the patient is sitting there. They can input it themselves even, and just do the little questionnaire and just identify if they are at risk there. And then the final one that I like to include is the sleep apnea one as well. And there is a really quick questionnaire called Stop Bang that you can do. I have a few of these like printed off already that I just have sitting there, and I just get them to do the questionnaires. There's also the Epworth Sleepiness Scale. I think there's a couple of others, but I pretty much use the Stop Bang one 99% of the time. This is another area that often gets overlooked. People are tired and they just, brushing it off, going, oh, well, that's life. Well, maybe it is, and maybe it isn't just life. But if there's snoring and they've got some other issues that are factored into that questionnaire, then there's a real possibility that sleep apnea could be an issue. And if that's an issue, then we are at risk of having some other problems as well, because we know that sleep apnea is associated with things like hypertension, AF, coronary artery disease, metabolic syndromes, obesity, and diabetes. Plus, there's also that negative feedback loop. So they've got the sleep apnea, which then it worsens their hypertension, which then worsens the sleep apnea. So we've got this little vicious negative cycle happening there. So if we can do an assessment, and if we can go and do some investigations and identify that sleep apnea is a problem here, then we can be starting to address perhaps more than one health issue for this particular person. And it's a very real risk factor for them developing some of these other issues that are associated with OSA. So a really, really important inclusion, I believe. Just some interesting data about the osteoporosis stuff, or the osteopenia as well. And this is why I include this in my health check for people in this age group, because once we get to people in this, like in the next age range, like 50 to 69, we are starting to see high levels of osteopenia. So doing the assessment now in this 45 to 49-year-old group, we can potentially be starting to impact the osteopenic phase. So look at those numbers. So half of men and women are developing thinning bones by the time they're in their 50s. So here's the time to provide the education on the amount of calcium that should be taken in their diet at this age range and stage of life. So print off the information. It's all there on Healthy Bones website. Information leaflets about calcium, about exercise, not just cardio, but doing the strength-based stuff as well. This is a really good opportunity to start having an impact on this particular issue, because it's just going to get worse. And some sobering data, as I was saying about before, with mental health. You know, this age range that we're sort of starting to creep into here, the statistics, the suicidal stuff it's very sad, and it's a very real problem, and just mental health disorders in general. So 1 in 6 men and 1 in 4 women, in that Australian Institute of Health and Wellness survey, they said that you know, they're experiencing a mental health issue in the previous 12 months. So again, another huge area that sometimes just doesn't get talked about. They often don't find the time. They only go to the doctor if they're absolutely sick, but they don't go to the doctor to just talk about just day-to-day stuff. And a lot of people just pass this off as just life, but it doesn't have to be that way. And we clearly know that it can escalate to being more than just having a few bad days. So please include these kinds of things in your health assessment. It's really worthwhile, and I know I have certainly have picked up quite a lot of different things with people in this age group, because I'm adding these extra things into the health check. So yeah, please look into doing these ones, because it's yeah, it's really important. All right, next we are going to be doing the type 2 diabetes risk evaluation assessment. So in order for this to be done, this is a time-based assessment once again. However, the person needs to be aged between 40 and 49, and they have had to have had an OSD risk score, an OSD risk assessment in the past 3 months, and that score was greater than 12, meaning that they're at high risk. Now, this may have been picked up just through routine things with the doctor. So they might have done some bloods, and we've got some elevated HbA1c, we've got some cholesterol starting to elevate there, and their lipids being a bit deranged. There may be some extra kilos that have been slowly put on over the last couple of years as they're sort of starting to get to that whole middle age area. So we're starting to look at a few different risk factors here that may push this diabetes risk into that high risk range. So sometimes this might also be picked up with the nurse. I know in places that I've worked before, every time we did a new patient intake, and if they were in that age range, we just automatically did an OSD risk score, and we would find out, you know, pretty much straight away whether they had that risk. They don't have any history of diabetes, but they've got a high risk for it. So that means that at some point we can get them back and do an assessment properly. You can do it as a quality improvement activity in your practice as well. So one way or another, we're going to do this OSD risk assessment, figure out what someone's score is, and if it's high, then we're going to go ahead and do this assessment. It is claimable every 3 years, as long as they are remaining in that 40 to 49 year age bracket. All right, so if they turn 50, they can't have that assessment done again. All right, so the things to include. So obviously we're going to just do our usual basic stuff. You probably get the gist of it here with me with the SNAP assessment and stuff. And we're going to make sure that we've got all of those details and identifying where exactly those high scores came from when we did that did the OSD risk assessment. So was it a modifiable risk? So age and gender, and I'm talking about biological gender, male or female here. That's just your anatomical predisposition. there. So sometimes that's going to elevate the risk, or if there's a family history, so we can't change that kind of stuff. But things like their lifestyle factors, obesity, those sorts of things, are these the areas that we can be starting to address in order to help mitigate some of this risk? Are there any other clinical investigations that we can be doing apart from doing their bloods? Can we be doing maybe a glucose tolerance testing instead, referrals to dietitians or exercise physiology, those kinds of things, to sort of start getting some interventions happening to start reducing this risk. And of course, we're doing patient education and information as well as part of this health check. Um, that's pretty much it for that one. The main thing is gathering the information and trying to determine where those main areas of risk are situated for that person. All right, so the next one we're going to talk about, I'm not going to go into this one too much because it's pretty self-explanatory when you do the CHAP assessment. So this assessment is done for anyone living with an intellectual disability. There's no specific criteria on what constitutes an intellectual disability, but essentially, if it's been medically diagnosed by a specialist or something, it's most likely to have been present from birth, or it could be also an acquired brain injury that has occurred somewhere along their lifespan, and so then that would sort of meet this criteria as well. This can be done annually, and it is available for adults as well as for younger people under the age of 18. So as I said, the CHAP assessment, so this is the Comprehensive Health Assessment Program. This is now available for free to download and use, and you can get that through the Department of Health and Disability and Aging. I don't know that it's embedded in any of the clinical software. I could be wrong, so if you do know the answer to that one, please pop that in a comment below. I'm just not 100% sure on that one. I often just, have it bookmarked on my computer, and I just go in and do the fillable version, and then we print it off. So generally, it's two parts. The first part usually is completed by the family members. It can also be filled in by any support providers and stuff like that. Generally, the nurse or the doctor will go through that first section and just sort of check to make sure that we're aware of all of the bits and pieces that are in there. There are some things that the family or the support workers can highlight as identified issues and things like that. So yes, generally the clinical team will review that. Then part 2 is completed by the doctor. So the nurse obviously can assist with the gathering of this information, but overall the GP needs to be the one to review all of this, arrange any of the follow-ups or anything like that, any further investigations and referrals, and create any action plans. So if they have a choking hazards or anything like that, then those things are all done as part of the assessment there as well, or medication charts and stuff too. So I'm not going to, if you follow through the template on that CHAP, it's very inclusive of a whole holistic range of physical and psychological, social kind of things, and their ADLs and stuff like that. So I'm not going to itemize all of that in this particular video, but it's all very well set out in that CHAP assessment. So the next one I'm going to briefly talk about as well is the Veterans Health Check. Now, I'm going to admit that I haven't done many of these. I think perhaps a couple in my time of doing these. Generally, I think it's an area that has just not been well done. Some of it is included in, I think most of the time, some of these health checks would be getting done through the veterans programs. However, I think the eligibility for doing this particular one might be slightly different. So it's not related to whether someone has a gold card or a white card or anything like that, like a DVA eligibility classification or anything. So simply this one here, they just have to have been a serving member of the Australian Defence Force or a reservist, and have transitioned out of the ADF now. So it's either a one-off assessment if that was some time ago, or it's if they've transitioned out of that after the 1st of July 2019, then this can be done as an annual health assessment. Your practice software definitely has this embedded into it, so you can just go off the template. It's very easy to just follow it through, but you can also go and download the template if it's not in your software. You can go and download that from the DVA as well. So it's pretty self-explanatory to go through all of that. And again, I would allow up to an hour to complete this one, and the nurse can absolutely be involved in doing a vast majority of that information gathering. The next one, again, I've not done too many of these because I've just not really worked in an area that has had a lot of this community of people. So your practice might be different. And if you're in a very targeted primary healthcare field, working specifically with refugees and humanitarian assistance, then this will probably be something that you do a lot more often than what I've ever done. So this is eligible for people who are humanitarian entrants into Australia. They're holding a visa, and therefore they're eligible to have a Medicare number as well. It should preferably be done within a month of them arriving into the country, because the whole point of this is to get a bit of an idea about their current health status, so that we can be making sure that they're getting the appropriate care. They may not have been getting that care from wherever they have come from. But also preventative healthcare. So now that they are in Australia and they do have access to high quality healthcare, what can we be doing to ensure that they remain healthy and well and out of hospital and stuff like that? So we are going to be making sure we are getting a full history, and that includes their medical history, of course, but any family history, lifestyle stuff, their migration history, where have they come from. Sometimes refugees have had to come through several different countries before they've actually made it to Australia. So we might want to check where those countries have been and what kind of conditions they were kept in, where there may be malnutrition, they may have injuries, wounds, all of that kind of stuff. So we want to do get a real good picture of these people, where they've come from and how they're presenting to us now. Preventative healthcare, as I said, immunisations is a big one, and we can arrange catch-up vaccinations for them. Cancer screening, so women's health, cervical screening, mammograms, those kinds of things. But also men's health stuff is really important too. So I think investigations wise, we're obviously going to be doing full screening for bloods. Do we need to organise any x-rays, chest x-rays, to be checking out their lungs and stuff like that? Have they been in TB zones? All of these kinds of things, ECGs, that sort of stuff. So we're just going to be doing a full workup to try and get a really good picture of where these guys are at, and therefore how we can be best helping them in the future. So obviously we're going to be planning some follow-up care as a result of whatever information we gather as part of that assessment. All right. Finally, the big one we are going to cover today is the assessment of the older person. So this is specifically targeted for those people who are over 75. So this is a very holistic health check. A lot of the times these people already have some kind of a chronic disease management plan. So this is a great adjunct to that, because this can often sort of be covering things that aren't necessarily always covered in their chronic disease planning. So your practice software, once again, is going to have this built in. It's a great framework, but you can also add some extras. Some of these other assessments are also going to be present, so things like your nutrition assessments, your mental health and cognitive function, all of those sorts of things. Those assessments will be present in your software, but again, you can also access them externally and be doing different assessments based on those individual needs. So we are going to ensure that we're doing their full observations here. Always do height and weight, and I will always do their height measurements without their shoes on, so we're getting a barefoot height. This is really important when you're sort of measuring for height loss over the years, especially when there's osteoporosis present. Blood pressure, sitting and standing. So we're going to be looking for any orthostatic changes there. And we're looking at heart rate and rhythm. Are they having a regular heart rate, or is there some kind of an arrhythmia present? We're going to include some point of care testing, so urinalysis. A lot of my people coming in for their health checks will come in with their little urine jars already done because they know what I'm going to do. And if it's appropriate to be doing blood sugar tests and stuff like that for them, doing an ECG. I do like to do an ECG regularly. If I haven't done one in the last 2 years, then I will definitely have one done because I just like to keep a monitor on things. And definitely when they're a 75 coming in for their first ever one, I will always do a baseline one. Then we're basically looking at things like their preventative health stuff. So where are they up to with their immunisations? Have they got all their age appropriate scheduled vaccinations on board? Is there anything that they're missing that we could be doing today? And then, of course, your screening, so your bone density. Some people do still continue to do things like mammograms and stuff, even though they might be past the screening age or to be on the registers for most of those screenings. But by all means, people can still voluntarily do them. So you can follow up on those kinds of things for people and make sure that they're informed about what their rights are in terms of continuing the programs. So yes, making sure bone density is a really big one. If they haven't had a baseline one done from 70 years of age onwards, then let's get them done. And then we're just looking at a whole bunch of ADLs. Okay, so how are they coping with their regular activities of daily living, from their personal hygiene? How are they doing things around the house? They're cooking, they're cleaning, they're shopping, they're paying their bills, all of those kinds of things. Are there any areas that they are struggling with, even just a little bit, just finding it a little bit hard? Is there some slight challenge happening with any of these activities? Physical activity, what are they doing to remain active, if anything? And consequently, where are we going with in terms of falls risk for that? So if they're not very active, they're not very stable on their feet, are they using any mobility aids like a stick or a walker? And looking at how safe they're actually ambulating with or without these assistance aids. So that's a really important one. I think there is a community fracture risk, a falls risk assessment tool that you can use rather than the hospital-based ones, which is not always appropriate for a community setting. We're also looking at their medications, and are they safely managing their medications at home? So are they using a dosette box? Are they just getting them straight from the packaging? Do they have a Webster pack or a roll? Are they polypharmacy and could do with a home home medication review? Those kinds of things. We're sort of looking at that whole range of safety issues with regards to medication. And do they have any concerns about their own medication? Are they worried about something that they're taking? Sometimes I'll go, oh, look, I get a bit confused. This one looks like that one. So if that's the case, then ask the pharmacist to provide a different brand, or if they're not using like a Webster pack or a roll or something, then is it worthwhile looking into doing something like that so that they're minimizing that confusion? So we're just looking at that whole safety aspect around the safe and quality use of medications. Nutrition, another really big one. From appetite, because I do hear a lot of people in this age range that I just don't seem to eat as much as I used to, which is all okay, but are we still having enough nutrition even though we're not having the same volume of food? So the nutritional aspect, you can still be eating food but being malnourished. So I do like to have a little bit of a chat about the kinds of things that they're having and what food groups are they still, eating a lot of, and making sure you get calcium, fiber, fruits and vegetables. Having some protein is still really important. A lot of people will say, I don't eat much meat. Okay, are you having some chicken or fish? Having some eggs? We want to be making sure we've got that protein there because we want healthy skin, healthy bones, healthy tissues, and all wound healing, all those kinds of factors. And also, how are they going about availability of food? Do they have trouble having to go to get their shopping and cooking food? So, well, I eat a lot of microwave meals because I don't cook for myself anymore. Well, it's better than nothing, but some of those meals can have high sodium, and maybe not as nutritious as they could be. So some educational support can be provided around having access to nutritious food. Continence, we're going to be assessing that. Is there any need for referral to the continence assistance programs in your state? They do vary a little bit there. I think there is Commonwealth ones coming up in the new upgraded aged care packages, which were supposed to be coming out in July 2025, but I think they've been put off for a little bit longer. So yes, assessment there for continence, and if any assistance is required with that, or investigations as well. Social interaction is a really important one. Do they have any special interests and hobbies? Do they getting out and about and going on outings with family or friends? Are they seeing people other than just themselves or their partner at home? They're interacting with their neighbours. All of those kinds of things are really important because that loneliness is a big aspect for a lot of people, especially when they're living alone. Home safety. Are there any modifications required in their bathrooms, in their toilets, access to the home, back door, front door? Do they live in a two-story house rather than a single-story unit? So lots of all of this information gathering is really important to assess that safety aspect. What are their living arrangements? Do they live by themselves? Do they have a medical alert system in place? Who checks in on them to make sure that everything's okay? Sometimes there's a bit of an informal one, especially people who live in a little complex with other people, or a little villa unit system. I've certainly had people say, oh, well, I know that if Dot hasn't got her blinds up by 8 o'clock in the morning, something must be wrong, so I'll go and check on her. So she just might not be feeling very well that day. So great, you've got a little informal neighbourhood network system going on there. Love it. But if they haven't got that kind of thing, then talking about the safety of having some kind of a medical alert button and things like that as well. Do they feel secure in their home? Are they living in a neighbourhood that's perhaps a little bit dangerous at times? Are they worried about people illegally entering into their home? They've got dodgy locks or whatever. All of that information is really important to get. Next we get to the cognition. So there's a few different tools that we can use, from your basic MMSE through to the RUDAS. There's MOCA, GP, cognitive assessments, things like that. So whatever is the preference at your practice, your doctors. Sometimes a combination of some of these. I know I will sometimes do the MMSE, but I think I have a feeling that maybe that they were kind of finding that a little bit too easy, so then I'll go ahead and do the RUDAS and I get a little bit of a different picture. So especially if you just keep doing the MMSE every year, then they tend to remember some of the answers and they come in going, I know my 3 words, or something like that. So shake it up a little bit and look at perhaps incorporating one of the other assessments to see if you can get a bit more of a holistic picture of their cognitive function. Also, don't forget the depression scales. So you're looking at the DAS-21, because depression and anxiety and stress and loneliness and grief and all of that sort of stuff really does come into play in this age group. They are probably starting to lose loved ones and not just family members, but friends as well, that they, no longer around. And so they can start to sort of feel a little bit helpless and depressed because of all of this end of life stuff that's around them. So it's a really important time to take the opportunity to have these conversations with them. And that kind of segues into doing, end of life planning as well sometimes. So do they have a will in place? Do they have power of attorney, enduring guardianship and all that sort of stuff allocated? And have they got an advanced care directive? And if they haven't, then you can give them that document and talk about how to go about filling it in, bringing it back, and having that saved on file for them. And finally, just, checking in on the services that they either have or may need. What support do they have in place? Have they had an assessment done? Have they got home support package? If they have, is it enough? Do they feel like it's not adequate? Do they need a review? And just providing some information and some support with them around that, if they need anything extra. What other local support services are available? I know where I am, we have what we call the Blue Dot Garbage Service. So if they have mobility issues and they can't put their own bin out, they can register with their council, their local council, and the Garbos will just pull up and go and grab the bins out for them and make sure that their rubbish is collected every week. There's all sorts of kinds of community organisations around that can deal with support for transport, social interactions and all kinds of stuff. So getting a bit of an idea of what kind of services are available in your particular area that can service your particular community. It's always really worthwhile to help support your older person. The other thing to remember too is that this assessment can be done in their home. It doesn't have to be done at the practice. Sometimes it is a good idea, especially to do an initial assessment in the home, and that way you do get a really good idea of what their needs are. And you can have a good look at their environment, their hazards, their risks, all of that kind of stuff. The only thing is with that doing it off-site is that at some point they will need to come back in and see the doctor face-to-face in order for the GP to do any physical assessments and to finalise their overall health check and therefore submit the billing. Alternatively, some practices, both the nurse and the doctor will go do a home visit and do the assessment that way. Obviously, that's going to be a long assessment, item number, the 707. So, the $300 odd that is available for that item number would probably cover the time that it took to have the doctor and the nurse off-site. So, again, it's a individual practice decision as to how you like to have them done, and it can also be an individual decision based on that person. They may have some mobility and some access issues with coming to the practice, so maybe an in-home assessment would be better. So that's up to you guys to decide, but it's certainly it can be done for sure. Okay, I think that's probably about it. The only thing that I probably haven't really included in this particular video is about doing the 715 health checks. Those assessments, there are templates available for each of the age groups for right from birth through to the older person. So they kind of split them up into children, adolescents, adults, and older person. So you just basically follow through the template from beginning to end, and you just do that holistic assessment that way. They can be a little bit difficult and challenging to get this particular cohort of people to come in to see the doctor on a regular basis. I guess it's always about building their rapport with them, ensuring that your practice is a friendly and welcoming place for them to attend, that it's culturally appropriate and respectful, and the other option is also to recommend that they attend their Aboriginal health service if there's one local to you, and have the assessments done there. A lot of the times they will do that because then they can access other things that might be also on site, like dental care, and such other allied health services. So as long as they're getting their health check done, doesn't matter where it gets done, but it's always a good opportunity anytime that you have an interaction with them to discuss it. The other thing to remember too is that it doesn't always have to be done in one go. So you can be doing different elements at different times, but once collectively all of those things have been done, then you can go ahead and finalize and submit that billing for the 715. And then of course from then on you can utilize your nurse support visits to follow up with them on all kinds of different things. And don't forget the telephone item numbers that are associated with both of those nurse support numbers, because we can absolutely do telephone consultations to follow up on some things associated with either their chronic disease management or their health checks, and be making sure that they're keeping up to date with all of their appropriate health care. All right, well, thank you so much. This was a bit of a long video, but thanks for bearing with me. Please feel free to save it and come back to it, watch it again, pass it on to some others who might also find it beneficial. And yeah, please subscribe to the channel if you would like to keep up to date with some other things, and by all means provide some suggestions on any other topics that you would like me to cover as a practice nurse mentor. Thank you so much. Bye for now.